Okay, so Biscuit's here and she's happy now because she's got her breakfast. I have notes because I have to do notes or I won't remember this and I want to get it right. So I'm glad you're here. I promised you a Biscuit update as soon as I could, and here we go. So if this is your first time meeting Biscuit, I got her around the beginning of April, I guess. And when I got her, I knew that she was lame. We didn't know what the injury was. She hurt herself back in November. So I've been kind of watching her and keeping an eye on it. And then I decided I better get her to the vet, and that was about a month ago. And so the vet did some x-rays. See, I have to read or I'll be blank. So the vet did some x-rays and a lameness test. And after she looked at the x-rays, she wanted to refer me to a veterinary surgeon, which I'm all for. Like, I want to help this girl. So the surgeon is like easily a 6-hour drive away. And I was lucky that I got to talk with her on the phone. I'm just going to tie Biscuit up so she stays with us. So I got to talk with her on the phone, and she looked at the x-rays, and she said that an ultrasound would help, and it would give her something to go on. She'd be able to look and see what kind of damage is done, because we don't know. And of course, Biscuit's not saying. I've asked her. She's tight-lipped about everything. She just looks at me, and that's about it. Come here, sweetheart. So this surgery, or the ultrasound date, is July 16th. And then if she's a good candidate for surgery, then that will happen on July 17th, first thing in the morning. So I want to tell you a few things about what the vet said it could be. She mentioned tendons, and maybe they're stuck together. This is on her off hind fetlock area. Sorry, should have said that right away. So if the tendons are stuck together, then they don't slide nicely with the movement of her fetlock, and that could be causing a lot of pain. And also there's a thing called an annular ligament back there, and it's kind of shaped like a cup, and it holds the tendons in place. So if this is the case, and if it's not too advanced, then we'll be able to, or the vet will be able to do surgery. And she said to me, I don't sugarcoat anything. I'll tell you, if she's a good candidate and I think it's going to help, then we'll do it. And if not, then we'll talk about other things. So that's what we're up to. And if she does get surgery, then after the surgery, of course, she'll have to stay for however many days it takes her to recover enough that she can do the 6-hour drive home. And of course, on the way there and on the way back, I will be stopping and letting her rest. And I'll film what I can. So I'm so glad you came. I hope this makes sense. And if you come along with everything, we're going to learn lots about tendons and ligaments and surgery and recovery time. And also, of course, if she does do the surgery, then she'll be staying in this area here so that nobody bothers her and so that she can rest and get well. And I think there will be bandages to change, of course, I think for a week to 10 days, and then slow recovery rehab, 5-minute walking, I think, to start, and so on. So anyway, I'm so glad you followed. I'm glad I got this update out, and it might not be the greatest, but I promised it, and so this is what we get. I love this mare, and I hope that we can help her. Yeah. So thanks for coming along. Hit the like button and please comment, and subscribe if you want to keep up on everything we're doing.